Hello there and welcome once again to The Verdict. Mick Cornett with Kent Myers, glad you're with us. We're here every week meeting interesting people and dealing with topical issues. We have a couple of friends on today.
We do indeed. Dr. John Chafin and Alan Puls coming on to talk about the heart of the matter. These are two physicians who are really experts in their field on dealing with heart problems and fixing heart problems. That's why we've called this show The Heart of the Matter. They're going to tell us about what they do, how they do it, and how you and I can avoid perhaps running into problems in that regard by our lifestyle changes.
No question this is a procedure that someone in your family or yourself is going to deal with at some time in your life, and we're going to learn more about it today.
Yes, if you're an Oklahoman, you're a lot more likely to have to deal with it in your life or some family member than maybe if you were living in North Dakota or something.
It's coming up today on The Verdict. Stay with us.
It's time, America. Our energy future can be ours again with American natural gas. We have an abundant, affordable supply, unrivaled anywhere. $1 billion a day for importing foreign oil isn't just a statistic, it's an opportunity. 30% lower greenhouse emissions isn't a pipe dream, it's a choice. Now is the time. Chesapeake, America's champion of natural gas.
Wilsey, Meyer, Eatman, Tate. We're accountants. We do taxes, business valuations, estate planning, and consulting. And we're right here in Oklahoma, working with the owners of small and medium-sized businesses. Steve Wilsey and Stuart Meyer have the resources and the experience. Wilsey, Meyer, Eatman, Tate in Oklahoma City and Tulsa.
Welcome back to the set of The Verdict. Mick Cornett with Kent Myers, and Kent's going to introduce today's guests.
Today we're thrilled to have a couple of very well recognized nationally and internationally folks that deal with your heart. And they are both involved in the treatment of the heart and various problems. On my right is Dr. John Chafin, who's a cardiovascular and thoracic surgeon at Integris Heart Hospital. John did his medical training at the University of Oklahoma School of Medicine. He's board certified in his profession. He has taught in this area, including teaching overseas. And as a matter of fact, he's a decorated Vietnam veteran. And this is his first visit to The Verdict. John, welcome. Glad to have you.
Thank you, Ken.
On my left is Dr. Alan Puls. Dr. Puls is an interventional cardiologist, also at Integris Heart Hospital. He did his medical training at the University of Texas, and he is a fellow in the College of Cardiology. He's board certified in both internal medicine and cardiovascular medicine. He's a runner and has competed in 35 marathons and getting ready for Tulsa Marathon coming up soon. Welcome, glad to have you.
Thank you. All right, Dr. Chafin, tell us about your practice. What do you do specifically?
My specialty is cardiovascular surgery, and in this context, we actually operate on anything from peripheral arteries, circulation problems in the legs, to circulation problems in the vessels of the neck, to lung cancers, but predominantly open heart, cardiac surgery, heart valves, heart transplants, artificial hearts.
Do you reach a point where you think you've seen it all, or do you still have a case now and then that's something you just haven't seen before?
Absolutely, and I think the thing that really keeps you stimulated, keeps you interested in medicine is that no two patients are different, and it's just a constant challenge.
So when you open them up, you really are looking for the first time, in a sense, at
Absolutely.
This particular case.
Absolutely. Everyone's anatomy varies a little bit, their blockages, the locations, exactly what needs to do is always a little bit different.
I know they do an awful lot of different, you do an awful lot of different things at Integris. Are you kind of a full service operation?
Well, our hospital is somewhat unique in that the cardiac surgeons, we're the only hospital in the state that actually does everything from conventional cardiac surgery to heart and lung transplants to LVADs to fully artificial hearts.
About how many open heart surgeries would you do in a year, we'll say, just approximately?
I do approximately 300 open hearts a year.
Wow.
What are the biggest challenges of that?
Oh, I think the biggest challenge today is just the aging and the disease that we're seeing in citizens, particularly of Oklahoma, increasing weight problems, increasing problems with diabetes, just an older, sicker patient population, I think.
So many surgical techniques within the last 10 years have gone from pretty significant intervention to minimal intervention. Is there any thought that maybe what you do with the heart on bypass surgery and the like, will it someday be less, less opening of the chest?
Well, clearly there is an evolution toward trying to do more things through smaller incisions, through less invasive from the patient from a recovery standpoint. And I think we've certainly in the last 20 years, my practice has seen an evolution into again, I'd say a less invasive, smaller incision, quicker recovery type of procedures.
But if you're going to get in there and do a bypass operation, for instance, you've got to have free and open access to what you're working on.
In general, it's better for the patient to have full exposure because of the unexpected or the unplanned problems that come up.
Well, Dr. Puls, let me ask you, what are you don't do the surgery?
I'm not a surgeon.
So how do you and Dr. Chafin work together? What heart services do you render?
One of the things that I do is to try to sort out chest pains. That's one of the biggest things that I do, is sort out chest pains. There's all sorts of different causes of chest pains. Sometimes chest pains can be the sore muscles, like an arthritis of the chest wall. Sometimes chest pains can be related to reflux, where extra acid comes up to the esophagus, irritating the esophagus. Sometimes chest pains are related to the heart, and you can have blockages with heart arteries. And that's one of the things I do, is to try to sort out, are the chest pains heart, or are they related to some other cause?
Mm-hmm. And what percentage would you say are related to heart? When someone comes in and reaches your comfort level, what percentage are actually having a heart attack, or what percentage are having some other issue?
Oh, I'd say probably 50-50 on that. Mm-hmm. Again, it depends upon whether you're talking about in the emergency room or whether you're talking about in the office and so forth. Obviously in the hospital there are going to be more intensive sort of a situation than the office.
You've been practicing a number of years, I know. What do you find most challenging about what you do?
I would say that the interventions are more challenging. It used to be when you would do these balloon procedures and stents, it was limited to just a single vessel in one little location. Well, nowadays it's become more complex, and so I take on the more complex cases, and what that ends up being is that the cases that are so complex are the ones that I give to Dr. Chafin, and he ends up getting, instead of getting when he first started doing bypass surgery, they were doing single vessel bypasses. Well, he doesn't get single vessel bypasses anymore, and they're all very, the 3-vessel, 5-vessel disease that are very, very diffusely diseased hearts.
How important is it that the patient describe their pain uniquely and distinctly? How much feedback do you need?
Well, there's all sorts of information you get from a patient on trying to decide, is that chest pain cardiac or is it non-cardiac? And so a portion of it is just from talking with them. But sometimes you have to use other tests. Sometimes you do stress tests. Sometimes you do these angiograms where you run the tube up from the groin up to your heart and inject dye. That's going to be the most exact test. But sometimes you can get some information just from talking to them, some information from doing stress tests and so forth.
What advice would you give our viewers if they're having, hypothetically, heartburn or what they think is heartburn at times not related to taking in food? What kind of advice would you give to viewers about what to do?
I think it needs to be evaluated. For instance, people come in all the time and they say, well, I got this pain in my chest, and it occurred after I ate a pizza, or it occurred after I ate something else, and it's not, and they try to talk me into that. Oh, this is just reflux causing this, and some of the time it's not, and so. If there's any concern, then they ought to go see their doctor about that discomfort.
And if it's in the middle of the night, their doctor's not available, go to the ER, I guess.
That's what I would suggest doing.
Before, we just got about 30 seconds before break, Dr. Chafin, what's the most challenging, most difficult surgery that you are sometimes asked to perform?
Oh, I think that probably the heart transplant from start to end is really the biggest. It's can be a 6 to 8 hour operation. Oftentimes the patients have had 2 or 3 previous heart surgeries. The technical demands of matching the right heart to the right recipient and putting it in appropriately, and then managing the early time of a heart that's been out of the chest, literally in an ice chest for 4 hours, and getting it to beat and support the patient.
How many transplants a year would you do, just on average?
Hearts we do somewhere in the 25 range, about 40 to 50 lungs on average.
We're talking the heart and how we can keep you from winding up being a patient from one of these two gentlemen today.
But you'll be well served if you are.
We'll be right back.
The thing that has made the most sense for me is realizing that I am still an educator, and that is what I do at the Chickasaw Nation. I'm Dr. Amanda Cobb-Greetham. I'm a historian, and I'm Chickasaw. The Chickasaw Cultural Center is amazing. It is a very, very special place devoted to the sharing and to the celebration of Chickasaw history and culture. State-of-the-art technology, exhibits that are not like anything I've ever seen. The Spirit Forest is incredible, and you feel as if you have actually just walked into a forest with huge trees all around you. It's timeless, and yet it's sort of also representative of our time depth, to really just sort of reach through time and touch the past. By the end of the exhibits, you really have a sense of Chickasaw cultural and political resurgence, and the extent to which we are a healthy, dynamic, and vital tribe today. Chickasaws have always been an inclusive people. This is something for the whole community and for the state of Oklahoma.
In 25 years, world energy demand will grow by 44%, with oil and natural gas largely meeting the need.
The question is, will America's demand be met by American resources?
Oklahoma says yes. We're developing the largest oil and natural gas discoveries America has seen in 40 years.
It's creating jobs and millions in tax revenue for schools, roads, and hospitals.
Oklahoma's oil and natural gas industry, advancing our state, empowering our nation.
When you have something important to communicate, it becomes clear that there's a lot of competition for your audience's attention. So how can your message stand out and actually resonate with your audience? Legal Graphics has the answers. The team at Legal Graphics will work with you to plan, design, and even test your presentation to ensure your message will be heard and remembered. Call Legal Graphics today to schedule an appointment. The readiness is all.
Welcome back to the set of the verdict. We are talking with a couple of cardiologists today from Integris, and we thought we'd start with a heart attack from the beginning, from inception. What actually happens there?
Once they get to the emergency room, what goes on, Alan?
Well, there's when people come into the emergency room, they're usually coming in with chest pain or some other symptom, and one of the first things that you do when they come in the emergency room is get an EKG. And EKG helps to determine whether they're having what's called an ST segment elevation MI, that's called a STEMI, or whether they're having a non-STEMI. A STEMI or non-STEMI is a heart attack where there's been some damage, and usually one of the blood enzymes, the troponin, is going to be elevated in that situation. So if there are EKG changes suggesting that they're having a STEMI, they need to go immediately to the cath lab to try to do a balloon procedure to open up that artery.
From the time they walk in till they get to the cath lab, what is the ideal time that should have elapsed?
For a STEMI, you would like to, the goal is 90 minutes. You like to have them that's called the door to balloon time, and you like to have, from the minute they walk in the emergency room until you get the balloon across the blockage, that should be less than 90 minutes. That the people are going to do best in that situation.
If they're not a candidate for a stent or for a balloon, but are going to have open heart surgery, how do you maintain them in a safe capacity until the surgery can take place?
If there's not ongoing ischemia, meaning that they're not having ongoing active chest pain, and there's no acute changes on the EKG, then usually you can use various medicines in the meantime to control things until surgery that Dr. Chaffin would do can get accomplished. There's medicines that lower the blood pressure down, there's medicines that thin the blood a little bit, there's medicines that slow the heart rate down, so all those things take some of the burden away from the heart until the vessels can be bypassed.
And when would you, in a case that involved you originally and maybe Dr. Chaffin coming in, when would you first contact Dr. Chaffin and what would you tell him?
Well, for instance, if the patient came into the emergency room and I felt like that they needed to have an angiogram done, and we did an angiogram and they had diffuse blockages that was beyond anything that I could fix with balloon procedures, then at that point I'd give Dr. Chaffin a call. If the patient was stable and not having ongoing chest discomfort and the narrowings were not life-threatening in the next hour or two, then he'd probably see him that day and do the surgery the next day is how that scenario usually works. On the other hand, if they're still having active ongoing chest pains and they got 99% blockages everywhere, he might take them to the operating room immediately at that point.
And how do you evaluate what's going to be necessary once you're in the picture?
Well, it's always a consultation between the cardiologist and myself. He will contact me and relay the anatomy or the problem we're dealing with, whether he senses that the patient, that he's been able to so-called cool the patient off or cease any progressive damage to the heart. If that's not the case, obviously, and just a plug for a big hospital is that you'd like to go to a hospital that has the capability to get you to the cath lab in a quick period of time, and not every hospital can do that. The 90-minute door to balloon time is a lot more difficult than you might imagine.
Really?
The coordination that takes, on-call people for the labs, on-call people for the operating rooms, and then having an adequate surgery staff so you literally could get that patient from the cath lab, which is just down the hall from the operating room, and into surgery and revascularized or the blocks bypassed. And we literally go from patients, as Alan says, that could go home and come back a week or so later when it was convenient, family was around, to patients who literally roll off one table and onto another table.
Most of them want to go home, I suspect.
Absolutely. Everyone wants to take a deep breath and think about it a little bit.
Yeah. Well, how's business? Are you seeing more work or less work in practice in Central Oklahoma?
Well, when I chose to come to Oklahoma and practice, I was shocked by the numbers, and they haven't changed that much, that we are a land of Marlboro men. People still want to smoke their cigarettes, they still want to eat their beef, they don't want us to intercede in that. So we're seeing not as rapid a changes in people's lifestyle as we would like to see. A lot of diabetes, a lot of overweight, a lot of people that still smoke. So business is good.
The cholesterol lowering medicines, how much of a difference are they making?
They actually have had a good impact, and the important thing is just getting into your cardiologist, your internist, getting your cholesterol checked and getting on the medication. So it's like anything else. We have people who come in at home with a heart condition or heart problem, and you say, well, do you have history in their family? And they say, yeah, well, my dad died at 50 and my mother, had bypass surgery, and I got 2 brothers with problems. And you go, have you ever checked your cholesterol? And they go, no. And, do you smoke? Yeah, I do. And so the problem is not so much the people that come in and get treated, it's the people out there that have a problem, that have a strong family history, that should know that they have a problem, and they aren't coming forward and seeking out and getting attention. You have so much better opportunity to survive a long-term good outcome if you can catch that patient before the heart attack.
Dr. Puls, I want to ask you a couple of questions. The first is, when I introduced you as an interventional cardiologist. Can you tell our viewers why that label is attached in front of cardiologist?
Sure. A regular cardiologist, non-invasive cardiologist, does not do these angiograms where you run a small tube from the groin up to your heart where you inject dye in there. And they also do not do interventions where they go in there and fix blockages with balloons and stents. And that's what an interventional cardiologist does. He does the angiograms and plus does these balloon procedures and stent procedures. And it takes specialized training to be able to do these interventional type procedures.
Let's say, the second question I wanted to ask you was, let's say you've seen a patient, they've either needed an interventional technique or perhaps Dr. Chaffin comes in and does open heart surgery. Is that patient going to be a patient of yours for a long time, or is that the end of your involvement with the patient? How does that normally work?
Usually when they require some sort of intervention like that, whether it's a surgery or whether it's a balloon procedure, you know, unless they have some different agenda, I usually take care of them on a long-term sort of basis at that point, because this is not something that you fix and will never ever have a problem again. This is something that's an active, ongoing thing where you have to kind of be involved with risk factor modification and so forth.
John, tell our viewers what patients typically report to you after the open heart surgery and that's gone well. What kind of reaction do they typically have after, I mean, once they're recovered and doing well?
My typical patient will be in the hospital 4 to 6 days. They go home, and as you can imagine, they typically will walk out of the hospital, but still requiring some pain medication and certainly family support. I see them back from 3 to 4 weeks from the time of the surgery, and the difference in that period of time is pretty dramatic. I have people who frequently will say, well, you know, I haven't walked in a year or two because I have shortness of breath or chest pain, and gee, now I can do pretty much what I want to do. And certainly by 2 to 3 months from surgery, I've got people jogging and skydiving and doing a little bit of everything.
What is it specifically that they were lacking before that they have after this procedure?
Well, they were lacking blood flow to the heart muscle. So the biggest thing we see, and obviously sometimes valves get involved in that as well, but predominantly the heart doesn't want to hurt itself. So when you've got a block, the heart will slow you down and try to avoid a heart attack by causing pain, causing shortness of breath, and limiting your function. And people realize they have that, they just don't stop and say, well, what could be causing this? So they just modify their lifestyle down to the level that they don't have pain or they don't have short of breath.
We just have about a minute left. I'd like to each of you answer this question in about 30 seconds if you can, but 10 years from now, how will your practice have changed? What's your prediction? Look at our crystal ball and tell us what your prediction is, how your practice will have changed in 10 years.
Well, lots of things have changed in cardiology. For instance, 20 years ago, they didn't have balloon procedures or stents, and so that has radically changed things. You know, nowadays, they've just released a aortic valve that you can put in from the groin. It is not widely done at this point, and there's a big learning curve associated with that, but that's something that's going to happen down the line. There's stents that are going to be absorbable stents that are going to be released soon. And new medications coming out all the time. It has to do with the clotting capabilities of the heart. So I think that as far as interventions are concerned, and stents and new medications, there'll be all sorts of new medications down the line.
John?
I'll just give the other side of that, and I certainly agree with that part of it. My concerns are with the cost of medicine. We're being asked to do more and more with less and less. I mean, we're getting the number of nurses we have per patient is being cut back, the number of operating personnel we have, and so on. So I have some real concerns with the cost controls we're being forced to function under.
Dr. Chafin, Dr. Puls, we'll have to make that the final word. Thank you both for coming on.
Yeah, thank you.
Thank you.
Appreciate it.
Kent and I'll have a final word when we get back.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information. And for almost 30 years, Oklahoma political, government, and business leaders have turned to the McCarville Report for accurate, reliable, inside information. Visit the McCarville Report online.
Welcome back to the set of The Verdict. Kind of a moral of the show today. I mean, if you haven't had a checkup in a while, you should probably get one.
Yeah, there's no downside to it. I mean, if you get a checkup and everything comes out fine, why, that's great. Yeah. But if something's amiss, you may as well find out about it before it gets worse.
And there's a lot of things they can do these days to prolong your life if you have a history of heart disease in your family. So.
Yeah, and we're not promoting Integris versus anybody else, but they are a full-service hospital, and I know from personal experience they just do a magnificent job taking care of the patients.
And you know, we didn't get too much into it, but there's Oklahomans have a problem, and so there's a good chance if you live in Oklahoma that you're more likely to have heart disease down the line. That's going to do it for this show. For Kent Myers, I'm Mick Cornett. We'll see you next week.
The preceding program was produced exclusively for the Cox Channel.